Hello and welcome to another episode of the program. I am Ogechukwu Okekwe. Emzor Pharmaceutical Industries Limited, an indigenous Pan-African manufacturer and distributor of medicines and surgical equipment, amongst others, has announced its readiness to begin local manufacturing of active pharmaceutical ingredient plants. The move is part of the benefit of Nigeria's efforts to address the rising cost of drugs and other medical consumables in Nigeria. The facility is expected to commence local production of API before the end of the year. According to the company's Director of Strategy, Funke Ashiru, she said the move aimed to improve the country's healthcare system as the facility will produce APIs for various medicines, including those used to treat malaria and cancer. Nigerian pharmaceutical manufacturers have raised the alarm over the creeping impact of soaring interest rates on operations, claiming it is hampering growth and threatening the industry's survival. They lamented that the high interest rates, which had reached 38%, have become a critical barrier to operational stability. Speaking at the 13th Annual Symposium and Award Ceremony organized by the Health Writers Association of Nigeria in Lagos, the manufacturers stressed that the situation has made operations impossible, urging the government to lower the rate to 20% or less. They urged that the government's focus on fighting inflation through the high interest rates is hurting the economy and that the government should prioritize growth instead. Let's go on a short break. We'll be right back. Welcome back. The digestive system is a gateway to nourishment. It works to fuel every cell in the body and get rid of waste. Neglecting the digestive system can have a diverse effect on parts of one's life. Diet and other lifestyle choices can improve digestive health. The digestive system consists of the whole alimentary canal. According to the World Gastroenterological Organization, 1/3 of the world population has some form of digestive symptoms. Most common are bloating and constipation. Well, joining me on the program to discuss further is founder Safe Throw Medical, who is also a public health enthusiast. Thank you for joining me on the program, Doctor. So what would you say are the characteristics of a healthy digestive system?
Okay, so like you mentioned, the organs that make up the digestive system from the mouth down to the anus. So if I would, outline the various characteristics of a healthy digestive system, then it will involve having healthy organs that make up this system. So having healthy oral hygiene, or a healthy mouth, a healthy throat, a healthy stomach, a healthy intestine, liver, and all that, because there are so many problems that could arise from each of these organs that make up this system. So it's quite broad. So it's to ensure that all the organs that make up the digestive systems are working properly. That is the major criteria to say, or the major characteristic to describe a healthy digestive system, is to ensure that all the organs that make up those systems are functioning normally. So, thank you.
So what would you say are the common symptoms of this digestive disorder?
Okay, the common symptoms that make up the digestive, or the common symptoms that could present from the digestive system, for the purpose of this discussion, so that I don't go, listing everything right from each organ, I will focus on the abdomen, the organs that are situated mainly in the abdomen. So one could present commonly with diarrhea, nausea, vomiting. You could have jaundice. You could have dyspepsia. Dyspepsia is maybe epigastric pain, reflux, that's having heartburn, and then, like you mentioned, bloating, or frequent passage of loose stools. That's diarrhea already mentioned. So if you're getting into very severe symptoms like tenesmus is feeling like you want to, feeling incomplete, voiding when you go to pass two and all that. So there's constipation as well. And then a number of symptoms like bleeding in stool, like maybe passing on bloody stools, or vomiting with, that's bloody vomiting, hematemesis, that's what it's called in the medical term. And then there are several others. There's, of course, abdominal pain, and all that. So there are a number of symptoms that could present from the digestive system, ranging from pain, discomfort, broadly like that. You could have all those things.
So for the bloating and gas, what would you say are the common causes and treatment for it?
Okay, there are so many factors that could predispose one to being bloated. It could be from what the person has eaten, and again, eating habits, that's feeding habits, and probably drugs. Yeah, some drugs can predispose one or increase, bloating. Just side effects of drugs, really. Yes.
Okay.
So for foods like beans, lactose-rich foods, maybe milk, oily foods, sometimes this can predispose one to being bloated. And then for eating habits, probably eating with mouth opened, chewing, and then you're inhaling or you're ingesting a number of so much gas while eating. So these are some of the habits or some of the things that could predispose one to being bloated. And then there are ways you can, simply prevent bloating. You can prevent bloating by maybe chewing minty substances, maybe, or like peppermints and all that. It could help, to improve bowel movements, and then you might be able to pass out gas. But if it's very severe and it's causing so much discomfort, there are other things we can give. There are PPIs, there are drugs we can give to help to reduce these symptoms. So if you feel it is lasting longer than it should, you should see a doctor that will evaluate you properly for you to get your treatments, and then he'll be able to prescribe some things or some drugs for you, the patients, to get properly treated. But bloating ordinarily is just to prevent or to avoid such foods, or to reduce, the foods. Or you can also try to eat well, maybe chew your foods well and all that. So it's very important to have a very healthy eating habits to prevent bloating.
So talking about symptoms that points to a problem where a problem someone has, can you tell us from the type of gas the person passes and the state of the digestive system?
Okay, so yes, sometimes as medical personnel, if we perceive, if we perceive, the kind of smell that comes out either from the mouth or maybe through flatulence or flatulence and all that. Once we perceive something, there are some diseases we could attribute such to. So take, for instance, diabetic ketoacidosis, for instance, person having ketone breath, or someone who has uremic gastritis, the kind of breath the person will be uremic fetals, that's what we call it. So these are some things that we could pick, from telltale signs that we could see or that we could perceive and say, okay, yes, this is what it smells like and all that. So basically, it doesn't really matter other ways or other, less, or let's say minor symptoms and all that that doesn't attribute to any condition. You can't really tell, but there are some very significant or very distinct features that we could see from people who have uremic gastritis or DK, like I mentioned earlier. You could tell that, okay, the way this gas smells, it could likely be so. So that's it. So most likely this, most likely that. So, but you cannot really attribute it to that until you investigate. So that's just.
So there are some food components that some experts talk a lot about. One of them is fiber. Can you tell us a bit about fiber and why is it so much talked about?
Okay, yes, high fiber diet is encouraged because It helps to improve the gut microflora. There are useful bacteria that are found in the intestine or the gut of humans. So they improve the gut microflora to help us prevent infections. They also help motility, that's the intestinal motility, to help food to pass through, and that thereby reducing or preventing constipation. So high fiber diet is very much recommended for patients who have constipation, who are constipated and all that, and also patients who, are probably on long-term antibiotics, or probably patients who, even diabetics is a very good, staple diet for diabetics. It helps them, don't really retain they don't really contain high glycemic index, so the sugar level of these patients could be controlled if they ingest high fiber diet. So it's really rich in fiber. Fiber is helpful for the gut, and also for blood sugar, and also for cholesterol levels and all that. So it's quite important to always include high fiber diet in whatever we eat. Vegetables, tubers, corn, all these things, whole grains, really, yes. So they're very rich in high fiber. So they're very rich in fiber. So it's quite important to include that in our diets.
Okay. So we seem to have a massive problem in Nigeria where many people are afraid to buy fruits because of forced ripening. Some people say when they take banana, they have stomach complications because of carbide. Is there some truth to this, and what can we do about this?
Well, we can't really run away from the dangers of, what's going on all around in the food sector, people trying to make a lot of profits, and then they just go pluck unripe fruits and try to hasten the process of their ripening. So it's quite important that we ensure, and we, recommend, and, emphasize the need to take fresh fruits. Fresh in the sense that if you can plant, or if you can have these trees yourself, it's important to do that. And it's important to have that, to have the gardens, have your fruits yourself, have trees that you can plant at home, take your fresh fruits. But in the absence of this, you should ensure that wherever you're getting it from, it's not a place where you don't trust, and it's not something that, and, they've mixed a lot of chemicals to ripening these fruits. Because of course, people do this, just to maximize profits and all that. They do this. So, and it has its own adverse effects on the health of individuals as well. So it's important to get our fruits and vegetables from a reliable source. And of course, we always ensure that hygiene is very important. So if you get these things, don't say it's banana, so you just eat it, without washing it. So you have to, before peeling the banana, you can as well wash it, and then you peel, because that way you're also preventing the risk of eating contaminated food, and thereby predisposing yourself to the outcome, maybe another adverse outcome that will cause you abdominal discomfort. And then banana itself contains, some nutrients, or some micronutrients, or some some substances that could also be allergic to. Some people are allergic to those substances, so it can also cause them discomfort. So if you take a lot of this banana, it contains potassium as well. So people who consume so much, you can eat maybe like a bunch at a go. That's wrong, really wrong. So from there, you have stomach upsets, of course, because your body will be trying to get rid of so much banana that you have ingested and all that. So sometimes some of these things is not necessarily the fact that they've used chemicals to ripen those fruits. It could be from probably someone who is allergic to some of the substances in the banana, or it could be from poor handling, or contamination of this banana. So these are the things that predispose someone to these things.
Can you tell us what a micronutrient does to the human digestive system?
Okay, micronutrients are, you know, they are nutrients that are needed in minute quantities, like in milligrams, less than 100 milligrams. Not unlike macronutrients that we need them in larger quantities, kilograms, and all that. So for micronutrients, they help in, they have various functions depending on what the micronutrients are. It could be from vitamins, it could be other micronutrients for food, maybe potassium, sodium, all those things, calcium, these things, magnesium, these things that we get from food, they are the other micronutrients that we can have in our body. We can get them from exogenous sources, or maybe from our fruits, from liver, from all that we ingest. So micronutrients are very important, because once you have your bigger nutrients, you need those small building blocks to help the cells to run, to help your tissues to also function. So those are some of the things, the needs that we need. Those are some of the importance of micronutrients. They put our cells together and help them function. They drive the cell. So it's very important that we have them in our diets, and we have them maybe in supplements and all that.
Okay, so can you explain to us what sugar and all these artificial sweetener impact in digestion?
Okay, so high consumption of sugar predisposes one to, infection. Yes, let me put it that way, because if you keep consuming high sugar and having hyperglycemia, the blood level you make it quite viscous, and it now forms like a needles for infection, needles for bacterial growth. Bacteria love sugar. They thrive where there is sugar. So you see them being predisposed to infections and all that. So it's very important that you cut down on sugar, artificial sweeteners, already made sugars and all that. It's very important to cut down. If you can avoid it, avoid it. So sugars are not so good for the blood.
So what tests are available to diagnose digestive issues?
So digestive issues are broad. They are quite broad. There are a number of them. So I will just give an overview of the tests that we could have. Laboratory, we could have radiological investigations that could be done to evaluate the digestive system. So for the laboratory system, for the laboratory investigations, you could do let's see. So for the laboratory investigation, so if I will list them, I'll say, okay, chemical pathology, chemical investigation, the blood investigation, that's for hematology, and then the microbiological investigation, so that's for microbiology. So for microbiology, we could do microscopic culture and sensitivity of the throat. So maybe there's throat swab, mouth swab, buccal swab. You can do for stool microscopy, that's getting a bit of physics and all that and checking it under the microscope, doing the culture and sensitivity. And then for chemical pathology, you can also check stool electrolytes, blood urea, and electrolyte urea and creatinine. Then we could also request for access stool electrolytes already. So for hematology, you want to do full blood counts, then blood culture and all this. Okay, that blood culture is also for microbiology. So you want to check to see where there is an infection. Then for radiological investigations to check the digestive system, you can do an abdominal ultrasound scan, you can do upper or lower GI endoscopy. There are another number of, depending on the symptom the person has. So you can check the other bigger investigation, going up to CT scan, MRI, and all that.
Can digestive issues be a sign of more serious conditions like cancer?
Well, yes, cancers affect everywhere, probably except the heart. So you could expect that the digestive system to have its own cancers, but the very, common cancers that affect the digestive system are colorectal cancers, and where the person come down with symptoms like melena, tenesmus, and all that. That's bleeding, or having dark tarry stools, having tenesmus, like I mentioned earlier, and all that. So these are the issues. The cancers can, point to some symptoms that I mentioned earlier could point to cancers, but it still needs to be further evaluated to be sure that it's cancer. So that's it.
So, briefly, what are the long-term effects of chronic digestive problem if left untreated?
So again, it depends on what the symptoms are. So one could have symptoms suggestive of typhoid, that's enteric fever, typhoid fever, and then if left untreated, it could be at the risk of typhoid ileal perforation. You could be at the risk of cancers, gastric problems. You could have PUDs, that's peptic ulcer diseases. Becoming up, bleeding. The ulcers by now, lead to bleeding, and that could also kill the patient from there. Upper GI bleeding, lower GI bleeding, and all that. So if left untreated, some of these symptoms can go so severe as to causing anemia, as to causing death, even causing significant morbidity and mortality.
Okay, founder Safe Throw Medicals and also a public health enthusiast. Thank you for lending your thoughts on the program.
Thank you.
And that's all we can take on this episode of the program. Many thanks for watching. See you next time.